One of our sons had COVID this year in February. We had had contact with him, and we had had our first COVID shots, I think 5 days before his diagnosis. So we were sweating it out. Neither my husband nor I became ill, and our son fortunately had a relatively mild case. Like many other people, he was completely exhausted and slept and slept and slept. But about 2 weeks later was tested again, was negative, and was able to go back to work. So our family story is not a tragic one, fortunately. I've heard of people in the area, but not close friends or people that I know personally, for which I'm very thankful.
My niece in the Boston area did get COVID. That was probably the spring of 2020. She's a medical assistant. She was actually doing COVID testing. If you remember, there were those outside drive-through sites, and she was doing COVID testing even though she had the plastic shield and she was all gowned up. So she did get it. She was not feeling well for a couple of weeks, but recovered, and she was fine. So if she's fine, then we're fine too.
I do know, yes, a few people that I do know have had it, but that's again a very, very small percentage out of the total, people that I do know.
So my brother works at the jail, and he was tested many times for that. That was part of their protocol. So I mean, I didn't see him for a brief period of time, but that was about it. My parents didn't come down with it, or no one else really close to me.
Well, not our immediate family.
No, not our immediate family. My sister and her family, so her husband and two daughters, her daughter's college age, they all actually got COVID last winter. So, and it was kind of scary, actually, when they first tested positive.
But they were okay. And they're okay.
They ended up okay, and they're fine.
Actually, my family was the first family that was diagnosed in North Brookfield. My father ended up going to a store to help me out because I had started a new job where I was working long hours, and he went grocery shopping in out of town, and he ended up getting sick shortly thereafter, and as it turned out, he had COVID, and I live with my father and also my brother, who's disabled, and we all ended up having it. My father ended up with a 16-day stay at Harrington Hospital because they wouldn't take him to St. Vincent's because at that time they were not going back and forth with different hospitals. They were taking patients that were being transported by ambulance to the closest facility. And we came real close to losing Dad. He's 88 years old, and 16 days, 2 admissions to the hospital, but he came out of it, and we're glad he's still with us. The COVID itself, there's so many symptoms, and everyone's symptoms were different. My brother and I experienced some of the breathing issues, but we had some of the other symptoms that are not so much related to it that people that have bad cases have. We had the migraine headaches, we had the stomach problems, the sense of no smell. That was very difficult. And my dad had everything though. He was the breathing, on the point of getting a respirator, but he didn't want any extreme measures, so he had already told us no. But fortunately, during the course of this, because it was in April of 2000 when we got it, they were trial and error with a lot of the medications, but they were able to work something out for him specifically. He had had 2 open heart surgeries prior, so with the heart problems, it became really critical. And like I said, we really thought this was going to be his end, but it wasn't. He had a lot of lung complications, and he still suffers from some of them. He's got the clear, but he did get pneumonia as whole part of this, and it really limited his abilities to do things. And since his COVID, he's never been the same. I think it's really taken a toll on a few of his other systems. So he's, but he's up in age too, so.
Shockingly, I don't even know how, if there's any wood around here to knock on, I will do so, because thankfully we have all been COVID-free. None of us have tested positive for COVID at all during this whole pandemic. I have one friend who tested positive, mild symptoms, and stayed home for 2 weeks and just talked on the phone a lot, but she was okay. I had one family member that had a pretty rough bout of it. He lives far away. I don't see him that often. It took him several months, but he was the only one that I knew personally.
The one person that I'm closest to that got it, she got it really, really bad and was in the hospital for a long time. And oh, it's gonna make me cry talking about it. I was really worried about her for a while. But she is better now. She's dealing with, what do they call it? Long COVID, I think it's called. Symptoms, having a hard time just sort of shaking it. I mean, it's been a long time since she's got it. I can't remember exactly. It was when school was still remote. So, but yeah, she had it really bad, and I was really worried for her.
I had a good friend of mine, he contracted COVID. He's not certain how it is he did contract it. Thankfully, he experienced some general malaise. That was the worst of it. He did have to quarantine, was unable to go to work. Co-workers at the boarding school, at least 2, had contracted COVID. Nothing severe, but again, they were unable to come to work, had to quarantine wherever it is that they live, quarantine. I've been fortunate. I have not contracted COVID. I did get vaccinated. The second vaccination was March 17th. So now here we are hearing about booster shots. So I'm eager to hear more about when the population will become eligible for booster shots.
Sure. So I had other relatives very early on. It's weird because I was following this in December of 2019, the reports coming out of China and this spread of a pneumonia-like virus. And then in January we were in Disney, and by February things weren't looking great. It would come to the United States. Unfortunately, the president at the time was downplaying it, saying it will be gone and there's no cases. And at that point, I was telling my relatives, don't go to restaurants. It's not a good idea. And my aunt and uncle did, and they got very sick. Like I told them on a Wednesday, and by the next week, they were so ill. So at that point, I was picking up their trash for them. I was delivering groceries to them, checking in on them, making sure they were okay. But they definitely had it. They had but there was no testing, so there was no ability to go find out if you had it. It was just, I lost my sense of taste and smell, and the bells and whistles go off. So there was that case. The other relatives, one was a healthcare worker and, didn't take it seriously, got it, gave it to her entire family, and we probably missed the incubation rate on that by 2 days. So we just dodged a bullet at Thanksgiving. But they were very sick. They had long-term effects.